Amit Thakker. He's the chairperson of the Africa Healthcare Federation and joins us from Nairobi. Doctor, thanks so much for giving us your time this morning. Now, do you think we will actually be able to vaccinate all adults in the next 3.5 months? It seems like quite a task, considering there are some parts of the world where people haven't even had their first jab.
So it's pretty impossible. I can tell you, we are looking at Africa around third quarter. Even through the increased access of vaccines, I think the sheer task of distributing it effectively with remote areas and all the other countries lining up to achieve adult vaccination, it's still going to take us 6 months at a minimum next year to achieve that kind of coverage.
And why do you think it will take that long? I mean, we had the COVAX program that was meant to give vaccines to poorer countries. We've recently heard that Nigeria had to actually throw away 1 million COVID-19 vaccines because they were delivered close to expiry.
There are multiple reasons. And one of the big ones is the sheer size, the remoteness. And we have to put vaccination stations in literally all the countries in the remote areas, making it easier for making vaccine reach the people rather than people reach the vaccine. That's the biggest hurdle. Of course, there is vaccine hesitancy in many parts of Africa that will reduce adult vaccination. And thirdly, there are still pockets in Africa where access is limited.
So, Doctor, I want to just move on and look at the latest Omicron findings that have been coming out from doctors and scientists. South African case studies indicating it's highly transmissible, but milder, which doctors there have said from the beginning. Do you think these new findings are going to impact how governments manage this latest variant, especially when it comes to travel bans and restrictions, which have been focused a lot on Southern Africa?
I'm on my 8th day of isolation, and I can tell you, with the Omicron variant and the infection, it'll be much easier to manage the entire travel ban, travel restriction, economic management. I think we're going to see a few controls. For sure, they are necessary, but it'll be much lighter than when we were dealing with Delta. I am confident that the economic backlash for saving lives and livelihoods and the non-pharmaceutical interventions will be far much more moderated than they were for the other variants that we've seen.
Okay, thank you so much for your time, Dr. Amit Thakker, live to us there from Kenya's capital.